because we are going to talk about something really very special. One thing is sure, I am also eager to have the participants joining on the Facebook page here of the Academy of Orthopedic Manual Physical Therapists for the transformation from a student to a professional. That is actually the clinical postings. And from any year during the BPT, the clinical postings can be, it's as per the institutions. I have highlighted that government institutions prefer first year BPT students to be observing without doing much treatments. Sometimes the first year BPT students are also given simple things like performing passive movements or positioning for the neurological patients or even cardiopulmonary in the ICU if they are aware of the universal precautions. And of course in ortho mostly they are asked to do ultrasound. They are also asked to perform what is called as keep the hot pack. The intern or the final year student will keep the hot pack and tell that student first year to just stand near the patient, keep an eye on the patient, anything patient wants means call me. Okay, so ultrasound they'll be giving, or they'll be putting the wax for the wax bath, or they will be like more of what is called as already the patient is walking independently, there is a caregiver with the patient. The therapist or the final year student might tell that walk together with this patient, okay, ensure that they should not fall. Okay, so we know that the patient is not going to fall. That is when the therapist or the intern will hand it over to a first year or a second year or a third year student. Why I am categorizing the first 3 years separate and the final year as separate? It's obvious, because you see the psychology of students. First year, the students do not even know what is the difference between the school and the college. Okay, students are entering into the college with whatever image they have about the college which they see from the movies. So they are not actually prepared themselves for the college curriculum and the process. Okay, so first year most of the time it goes into what is called as trial and error. They find out what is good, what is not, and they try to explore the environment in the college, explore the people, different types of people, and lot of things. Many people leave the parents and they come hostel, they stay and they are in the college. So that is something which are also many people who are not used to having a what is called as a different circle of friends. Okay, school means it is always right from childhood. School friends are like you choose them because you are what is called as pure at your heart. Okay, as a child. School friends always are lifelong. Okay, college friends are adolescent and adulthood choices. Okay, so you cannot rely on how the person or the nature. Okay, so there are a lot of things which will go to the self-image of the student, that am I right or wrong, am I attractive or not. Okay, so there are a lot of things that is there. Many people do easily get influenced with the social media like Instagram or other entertaining apps or dating sites in the adolescent, and hardly they recognize that as I am entering into physiotherapy profession, I am going to be a healthcare professional. So that is one side of the story. Other side, the serious students, the studious students, they are actually more of disappointed because they didn't get the medical or the dental degrees, and they got the physiotherapy and they are still not aware what is there in physiotherapy, and they are still feeling that unsure of where I am. Okay, so this is the first 1 year. Second year, if you see, after the first year results, they will try to see themselves as where I am in front of everybody, whether my preparation or performance is sufficient enough, whether my marks, my parents are happy, okay, whether teachers are how they are treating me, these all things they will see. Okay, so with respect to the college, the reflection will come in the second year only. And in the second year, they will also realize that who is actually genuine among the friends. So they will understand that and they will move on with the studies. Okay. So second year mostly their academic focus will be more, the involvement in the college will be more, and there they are more into the classroom learning, knowing the books, and what is called as seeing this what is called as the future. Okay, like what all scope can be there. They want to get motivated in the second year actually. First year they want magic, okay, but second year they want an analytical process where which is better than what and how we can do it, everything, who's better than who, everything they'll come to know. Okay, so they are still in that budding process, okay, in the studentship. Third year, actually what happens is the subjects also are distributed like that. First and second years are only the basic subjects. You see the preclinical subjects like anatomy, physiology, biochemistry, all of them are in the first year. Maybe some amount of psychology, if at all it is there, in Tamil Nadu, the BPT curriculum. But in the second year, if you see exercise therapy, the electrotherapy, and some amount of exercise therapy or biomechanics are also coming in the first year. It may be the semester system, but the first 4 semesters are basically the preclinical and the fundamental foundation knowledge for physical therapy. Okay, so this is what is first 2 years. So we are expecting them to build the foundation. Okay, we are expecting them to get that what is called as the inspiration. Okay, so the motivation. That is what we are expecting them. We are not expecting them to do anything. But in third year, the clinical subjects start. So, and especially the physiotherapy based subjects also, they are split between the third and the fourth year in terms of orthopedics, and maybe the cardiorespiratory can be in the third year, like as Rajiv Gandhi University of Health Sciences, Karnataka, the government university, they have like that. But in Tamil Nadu, it is the PT Ortho and the PT Neuro being in the third year. Cardiopulmonary comes in final year. Okay. So whether cardio is in third year or cardio is in final year, third and fourth year are the subjects which are like core physiotherapy subjects. And parallelly they have clinical neurology, clinical orthopedics, general medicine, general surgery, pediatrics, or geriatrics, so various subcomponents. Okay, sometimes community medicine may be a separate paper, but research and statistics is not actually an exam going paper. So this is the scenario. So when they are trying to know the disease conditions, and they are also knowing the treatment for every disease condition. Okay, so this is what the syllabus is organized as. If you have topic like low back pain, there are subtopics like lumbar spondylosis, so PT management, and then stenosis, radiculopathy, each and every condition being listed, spondylolisthesis for example, so like that. So disorder specific treatments like that. I have suggested the modification in the syllabus or the curriculum in the previous webinar for BPT syllabus, where I emphasized a totally different dimension. But today's we are talking about, with the existing reality, how to ensure a better clinical competency training. Okay, so first and foremost suggestion what should come, of course, the shorter we make them motivated, the earlier we make them inspired, it's always better. Earlier they realize that they are a healthcare professional, it's always better. So do not waste the first year. They will be attending labs of anatomy or physiology, it's fine. But clinical posting at least should be 1 hour. That 12 to 1 before the lunch or 11:30 to 1. Clinical posting should be there, preferably in colleges where they have the hospital in the same campus. Okay, college and hospital is attached. So definitely they should be in that, because it's very easy for them to go from here to there. It is just like 1 hour. Let them be in batches. Let them be like 5 students together for a single patient. But they should get that what exactly is happening in the reality. Okay. So you should not. What common error that may happens in the first year is these groups of students They are sitting in a separate room in the OPD. They are not with the patients. Okay. Many times we think that why to allow the first year BPT students in front of the patients? They will do something silly, and patients will be what is called as distracted. Therapist will not be able to give the best therapy. Okay. So these students are asked to sit in a separate room adjacent to the OPD. Okay. But remember one thing, instructions for discipline between classroom and clinical area is totally different. Because in classroom you wear the apron or not, no problem. ID card or not, no problem. Your nails, whether it is longer or not, that is not a problem. But as a healthcare professional, you know that longer nails should not be there. Okay. All the people who are doing MBBS and MD, imagine how are they wearing the gloves if they have a nail longer. It's not about hygiene alone. It is about the practical difficulty of having a nail and using the treatment techniques. Okay. You might keep your fingertips on the patients and it will be uncomfortable for the patient. So remember that the code of conduct or the discipline should be clearly defined to the students, and how that compliance, how the students will obey those depends upon the teachers only. Because if you see teachers coming with long nails, what are you expecting the students to do? Okay. And the teachers coming with big tattoos, what are you expecting the students to do? Okay. Teachers coming with open hairs, so what are you expecting the students to do? So teachers should actually be a role model and set a good example that how to be professional. Even the usage of smartphone in the clinical area, teachers can use it for communication. They can call somebody, they can talk, they can attend the call also. But any teacher should never ever use the WhatsApp or the Instagram during the clinical posting. You might be even the principal or the HOD. If you are doing that, you are setting a very wrong example for the students that I am senior faculty, so I will be using WhatsApp, okay, in the OPD. And during chatting in the WhatsApp, you go ask the student, okay, what you need? Okay. Ultrasound over now, okay. Now you can put tens, okay, and again continuing to chat. Horrible, okay. Please. If something like this is happening, students don't stay silent. Ultimately, the baby which cries only will get the milk. Okay? And always remember that it's most important to see what we can actually set as a best example. Okay? We should not be a wrong example. At the same time, what you have here is a kind of a conflict. Okay? That one side you have to be a role model, the teacher. I am talking the teacher's perspective in clinical postings. Teacher has to be a role model, the best therapist, okay, sincere therapist. Patients are happy to talk to them. Patients are happy to discuss with the therapist. They are taking therapist opinion. So that should be the role model for the patient, the student also. Okay, other patients who are watching also will think they are very cooperative. They will become. Always appreciate the patients openly so that other patients will get motivated. And if a patient is doing a mistake or an argument is there, make sure that the student should not be watching that. Okay? So if there is a conflict in treatment decisions, it's reality. Everybody is human being. But remember that you should not be what is called as propagating the negativity. Okay? Students should not think that intern made a mistake, okay, or faculty, the patient is shouting, okay, or two faculties are standing and talking about cricket match and upcoming movie release, okay. These kind of things should not happen, okay. I know that it is far from reality what I am talking now, okay. So but the reality is very worst, okay. It's totally opposite. We do everything and we expect that the students should not do anything. Okay, so they start thinking that these teachers are sadists, these seniors are ragging, okay, and the clinical posting, they don't have that what is called as that creativity, the enthusiasm to explore, ask questions. Most importantly, students should be encouraged to clarify their questions, but sometimes the experienced faculty who is regularly teaching and welcoming questions can also understand what kind of student is asking what type of questions, okay, whether it is genuinely for learning or it is just for testing the knowledge of the teacher, okay. What should be the concerns there? Because first 2 years, if the students are in clinical postings in a campus where the hospital is not attached to the college, hospital is far, make sure that at least 1 day or 2 days in a week, let the students go in the college bus and let them go to the hospitals, okay, so the attached hospitals. It may be even weekly once also, no problem, one afternoon, okay, or even one whole day, okay, rather than 2 afternoons, 1 day let them be in clinics. So let it be Saturday, because that Saturday is always the patient load will be more, okay, patients will come more on these holidays, they won't come on the working hours. So students will get a best opportunity. On 1 day it's hospital and attendance is very importantly maintained, so that they are, and college bus is important. Don't make the students to travel through public transport and go to that hospital, and they will tell they are delayed by the transport, and you will say why are you late, you will mark them absent. Then the students will feel that why did we come here, we are marked absent, okay. Clinics means so much it is strict, okay, so better don't go there, okay. And they will also bunk the posting and they will go to the movie there, okay, or they will be roaming around in the shopping complexes. So ensure that you need to get the people to the clinical posting, means they should feel that is a positive area of upgrading yourself. They should see that I am going to see my future, okay, my future by observing my teachers and also my seniors, okay. So that inspiration should come in the clinical area. If you are not able to maintain that, definitely clinical instruction will be compromised and the students will be nowhere. They'll be talking so much, but they'll not be able to even talk to the patient and take a history. Not taking the history, we must make the patient so open and comfortable that the patient gives the history themselves. You will see patients experience a very sensible therapist, the patients will tell extra, okay, themselves. So that is the skill of clinical communication, okay. And also interdisciplinary communication, that is also another challenge in the clinical area. So it's very, very important to know and learn these tips, okay, by realistic learning, okay, and with the experiential opportunities. So these all should be given there. Then of course college bus has to be there for the clinical area. If you are taking admission in a BPT college, please verify whether attached hospital is there. Also ask from when on is the clinical postings there for the students. Colleges, good colleges, best colleges definitely should have clinical posting from 3rd year BPT, okay, most of it. Whereas first and second year, if they have, they are definitely better and best category colleges, because ultimately we want them after BPT to be the good therapist. We are not expecting after BPT that they are going to teach another physiotherapy student, okay, but they should be able to treat the patient. So that aspect, ensure that when you are inquiring these things for your admission for your child or for your relative, make sure to decide the college by the attached clinical exposure and when is the timing of the clinical training, okay, and do they have a college bus to transport the students to the hospital. It's also important. Another question which usually should be asked, it is not actually done, is who are the people who are training them, okay, whether it is the faculty from the same teaching college, they are in the OPD and they are training them, or the clinical staffs are different, they never take classroom teaching, they only teach in the OPD and in the hospital, okay. So this can happen Even if the hospital and the classrooms are in the same campus, still the therapist can be separate. They may not be taking class at all. They are also MPT, but they are only predominantly in clinical teaching and supervision. They never teach in the lab, they never teach in the classroom. So this kind of situation means it's very tough for the students. Remember one thing, because one person will teach one thing in the classroom and this other person in the clinical area might do something different. The student will get the ambiguity that who's right. Okay? So, if they ask the doubt to the classroom teacher, they ask the doubt that what is correct, sir? You told that cold pack is not necessary, okay, for soft tissue injuries. But in OPD they are keeping cold pack only for all the soft tissue injuries. Okay, so this is the question. Because the teacher is teaching updated knowledge. He has seen the articles telling that acute sports injury, do not keep cryotherapy, do not keep cold pack. Okay, because it affects the inflammatory process, which is normal part of the healing. It is same like taking anti-inflammatory drugs. So now systematic reviews recommend that cryotherapy not needed for sports injuries. Okay, so this is what the teacher knows. So the teacher tells in the cryotherapy topic, in the electrotherapy, that sports injury is given in the textbook, but now latest things have come and better you don't use it, so that it is better for faster recovery for sports injuries. Soft tissue injuries, sedentary individuals, you can keep the cryo, but not for people who are athletes, because mechanoreceptors get deactivated, okay, with the cold, because the nerve conduction velocity is less, so the proprioception becomes less, and the patient is actually becoming more and more chronic and disability. Okay, so that is why sports people should not be given cryo, whereas sedentary individuals with soft tissue injury you can give the cryo. So this is told is in the classroom, but in the OPD the clinician may be just giving cold pack for everybody, whoever is coming with an acute injury, irrespective of whether it is a sedentary individual or it is an athlete who is having sports. So the student will get the conflict. Okay, what I learned in the classroom, what is happening here, and if to the clinician, if they ask, sir, this is soft tissue injury, but he is an athlete, sir. Can we keep cryotherapy, cold pack for athletes also? Then the clinician will ask, why? What is wrong? Why can't we keep? Then the student will tell, no sir, in class that sir told. What will happen there? I am not continuing with this description because you know the rest of the politics. The same way, classroom teacher is asked by the student also that therapist is using cold pack, sir. For athletes also they are giving cold pack, means what the teacher will tell. Most of the times the mistakes or the blunder from teacher's side, the classroom teacher will tell, clinical therapists are like that only. They don't have any updated knowledge. Okay? So the student feels, oh, clinical people are nothing. Learning from them is useless. Then how will they have interest in the clinical posting? Gone. And then they come to the clinical teacher, clinical instructor, clinical demonstrator, and they ask that, classroom teacher told like that, but here we are using like this. Why is it like that, sir? Like that means the clinical teacher will tell, see, that is textbook. Research, all these things are not practical. Okay? Reality, patient is getting better or not, we have to see. So, that patient you keep cold pack and they are feeling better means they want to become better in 15 minutes and go. In a textbook it will tell, for athletes and all, you have to give treatments for and rehabilitation extending to 6 months for return to activity. Here, who is coming in the OPD for 6 months? Okay? So they are coming only 5 days. In that time, they want a good relief. So cold pack we are keeping. I have seen in my experience 10 years I am treating patients, so I am keeping the cold pack. You will also see that without cold pack, if you want to treat and see, means you treat and see, nobody will improve. Okay? They will talk like this. Then these people will think, students will think, what? Oh, that means what the teacher is teaching is not happening in reality. What the clinical instructor is doing is actually not the actual truth of knowledge or the evidence. This is what the classroom teacher has told. The clinical teacher is telling that whatever the classroom teacher is teaching is not realistic teaching. It is only textbook knowledge. So what will happen to the students? Ultimately, where is the issue here? Of course, as I was talking about evidence-based practice, the issues in evidence-based practice in the previous webinar, the research issues, the priority is very, what is called as, it's high, okay? And we can also see that the number of views for that research webinar is more than all the webinars of the professional issues, okay? Within 24 hours it has crossed 550 views, okay? So research issues are more important. Evidence-based practice is a major concern, okay? And I have highlighted in that role of documentation in clinical practice. So clinical documentation is very important. So this is from student side. How you can improvise a clinical learning experience is, as you are taking notes when the teacher is teaching, same way take notes in the clinical postings when a therapist is treating. When a clinical demonstrator or instructor is explaining also something, group discussion, case discussions, one of the student has evaluated the case and they are presenting it, okay, the patient. So it may be a neuro patient, it may be an ortho patient, it may be a ICU patient or a diabetic patient or elderly patient or even a small baby with a sensory processing disorder. Remember one important thing, to take notes in the clinical postings, okay? Because unless you write down, you will not retain what you heard, what you actually learnt in the clinical posting, and it just goes in the air. So first 2 years, make sure that your participation goes to the extent of watching everything, listening everything, taking notes, whatever you understand better with relation to the syllabus. Because you have learned passive movement means whoever is giving passive movements, just watch them that yes, how are they doing lower limb, how are they doing upper limb, okay? In undergraduate education, in the classroom, the passive movements were told that you have to hold like this, another hand holding here, and then you have to do like this smooth movements, like, okay? In clinical posting, you will see that patient is sitting and hemiplegia. He wants to pick up an object, okay? So he has to pick up the object, and therapist is doing movement to make sure that he can pick up the object, okay? So this is functional passive movement, okay? So there you saw that it is structural or anatomical passive movements, okay? So where we are giving only in the anatomical planes, okay, flexion, extension or ulnar radial deviation. Here it might be a multiple joints which is working to pick up an object in the clinical area. Because hemiplegics, you should not give anatomical passive movements and expect that the patient will recover, because anatomical passive movements are for the joint and the muscles, whereas functional passive movement is for brain and the nerves, okay? So make sure that these differences will exist, and it's always an extension of the classroom knowledge and the improvisation of classroom knowledge that comes in the clinical practice. A clinician should be able to clear this and tell the students that yes, in classroom it was taught like this, okay, but here we don't do that, because here it is a neurological patient. If the patient comes after a frozen shoulder, we will try to do in the anatomical plane. But when it's a neurological patient, we want to train the nerves, so we give functional passive movement. Okay, so functional passive movement. Okay, so this is much important there. This is a basic thing. Of course, many of you may be feeling that, oh, functional passive movement is also there. Okay, I know. But remember, these are the things which has to be highlighted. You can't do the same passive movements year after year. You can do the passive movement if it is totally flaccid, patient is not having a voluntary control means, you can do the passive movement diagonally as PNF patterns. Okay, so PNF based passive movements. Because at least in that some kind of facilitation will come. Okay, neuromuscular. Doing it anatomically for a neurological patient is not the evidence also. So clinicians also should document so that they can be establishing practice-based evidence, which I highlighted in the research webinar, research issues. And if you see for the actual scenario, students also should be noting down so that at the end of the clinics, two things the students can do. One, the 10 people in that group sit for half an hour. Do a very healthy chit-chat discussion on what cases you saw in that clinical posting. If it is a half a day posting, even half an hour, 4:30 to 5. 5 o'clock is the closing time, 4:30 to 5 you do. And also remember that every time inform the clinical instructor, take their permission. Tell that, sir, we 10 of us, our group, we want to sit and discuss about the cases which we saw in the afternoon among ourselves alone. We want you to just observe us. Okay, if you make mistake means tell us, okay, afterwards. Anything you can tell. Whomever is, there may be always one person who is approachable, one person who is actually willingly taking discussions, explaining about the patients. When they are treating also, they are explaining to the students. They are not thinking that first or second year BPT, why to explain in clinical posting. Okay, there are sincere people in the clinical area. Even the teachers who are posted in the OPD will be more sincere, and the clinical area, whoever is maybe a junior most clinician, will be also more sincere, because they'll feel that last year I was a student, so I should teach my best. Okay, so such kind of people, keep them. If they are not there also, 10 people sit together, see your notebook. Okay, patient Sumita, that 45-year-old frozen shoulder. Then 3-4 people will tell, yeah, I have taken notes, I have taken notes. Like a group discussion, cheerfully talk. Because one thing you remember, whether you can remember textbooks or not, whether you can remember the patients directly or not, your own batchmates talking, you can never forget. Okay? So, you also learn from each other. Some person would have noted more, another person also would have noted more. So, they both will tell, yeah, this thing that sir did. Okay, that treatment he was doing, he was holding the humerus and he was giving the forces. Okay, and he was putting, even scapula also something he was doing. Okay, so these kind of things you might tell. Other people will tell. But he was asking about turning and all. Okay, so thoracic movement and all, I think it's important for people with frozen shoulder. One person will tell one point. Okay, so this half an hour of discussion should be there. If it is not there in the OPD, make sure that it is there in the coffee shop, because there is always a coffee shop in the hospital. Make sure that once the posting has ended, you are coming down, you are anyway having coffee. Don't talk about the Hrithik Roshan, don't talk about Tiger Shroff. Talk about the patients which you have seen in a very healthy and lively manner. Okay? So, until you wait for the college bus, definitely it's the best option. Even in the college bus when you are traveling also, just a chit chat about the cases. After that, you don't have to sit and prepare anything. You can retain the case. That is the importance there. The same thing goes with even classroom teaching. You take notes, you discuss about those classes at the end of the day for half an hour in the college bus. So in the coffee shop or in the hospital OPD, the last half an hour, if you're discussing the cases, in the college bus during travel, discuss about the classroom knowledge what you learned. It may be the morning college bus when you are coming, that time you can discuss, okay? Or it can be even the evening college bus when you are going back. Depends on when the clinical hours versus the classroom hours are. Another important thing which you can usefully do, people who are not going by the college bus and people who are traveling alone, which I have already mentioned in students' issues, that you can record your voice clip in the phone when you are reading the book or reading the notes. Even with permission, you can record the teacher's voice also. You understood or not? If you are not allowed a smartphone in your pocket, that rules, that college is a different issue. But most of the students have it in silent mode in the pocket. It is believed as a basic human right. Okay, you can't tell them that they should be without the phones. Okay, during the classes they should not use the phone. They should keep it switched off or in silent mode. So take permission from the faculty. See, the point here is this: don't do anything yourself assuming that it may be right, it is not wrong, all this thing. Every time ask a faculty, take permission. Sir, I have little bit slowness in understanding, so can I record the voice clip during your lecture? Ask them. If they refuse, don't do. If they tell, okay Baba, no problem, okay beta, you do the recording. Exceptional teacher, because he is respecting that the student is sincere to remember his words. Okay? At the same time, it should be a student who is sincere, who should be trying to write, trying to copy the diagrams in the board, asking questions in the clinical posting, everything should be there. If the student is full time sitting here and there, looking here and there, chit-chatting, and then wants to do sound clip recording, means the teacher will think, the clinical demonstrator also will think, you are taking the recording to show it to somebody and make their mistakes, make fool of them because they are doing mistakes. Okay, so they will be conscious, the teachers. Competent teachers will not mind people taking video recording also. Okay, so during a lecture, if somebody is taking video recording, during my demonstration, if somebody is doing video recording, means, and if they are hiding the phone in the pocket and the camera is there, okay, I will tell them that hold the camera properly, come here and stand, okay, because I want recording to be proper. Don't record my tummy, okay, so show me as I am doing the treatment techniques, okay, everything. And in clinical area, the use of smartphone, make sure that it is only academic purpose. If the faculty are using, means it is only for communication purpose and not for chatting or entertainment. Okay, so that area if you maintain, then even patients, you can take consent, you can have video of the treatment that is performed on the patients, so that the teacher can explain about that patient after the treatment with the video in the LCD projector. Okay, so it can be even 1 week after the patient was seen by the therapist, but the teacher can teach that in the LCD projector. And specifically during those sessions, the clinical teacher versus the classroom teacher, both are together. You understood what I am trying to tell? So that means a person who has taken lumbar spondylosis in the classroom, there is a faculty. The same way in a OPD, lumbar spondylosis patient came and the therapist was treating, he is also enthusiastically teaching everybody, and he has taken a video recording of the patient treatments. Okay, so then they can discuss together. The clinical instructor versus the classroom teacher can sit together in front of the students who are handling those cases. Another half an hour, show them the unity that classroom teacher or clinical teacher, we are physical therapist. And we are concerned about the patient improvement. Let's be open for inputs. Let the classroom teacher know that, oh, reality it is not working. Okay, I will better check why it is not working and I will do another research on that. Because the classroom teacher can do the research and modify. The clinical teacher will tell, okay, world over evidence they are telling like that. Okay, let me try without giving cold pack and see what happens. That is how we are actually bridging what is called as knowledge to practice, the translation. It's called as knowledge translation into practice. Okay, so that gap, if it is more clinical learning or clinical skill development of the students, will become a big question mark. Okay, because they will have ambiguity. Unless this gap is bridged, you are not going to take the next step forward. Next thing, when it comes to students who are directly handling the patients in third year and final year, this situation is one thing which is, first, if you have to talk about the issues, what are the issues? Students are calling themselves doctors. Calling themselves, see, patients, let them call you doctor. Even if you are a third year student, don't tell them, don't call doctor. Okay, let them call. They are calling themselves doctor in the social media. Facebook, WhatsApp profile, everywhere, doctor. Webinar, they are participating in webinar and their third year BPT and they are putting name for certificate means doctor. Then I will ask whether you have completed internship. At least final year have you passed? No, I am in third year. Then why do you want doctor in the name when you are third year? Your certificate is not valid only, the webinar certificate. Because the date of issue of certificate is during your third year. How you can be doctor? Understood? Although doctor prefix is conventional, use it after the qualification, not when you are as a student. And the next thing what they do is, house visits during the third year and final year, please do not do. At any cost, I am telling you. Only situation which you can do an house visit is your own house patients are there. Your uncle, auntie, bhaiya, babi or whomever, your relatives in your own house only patients are there means you treat them during third year and fourth year. Do not do extra house visits during third year and final year. I'll tell you the disadvantages of this. One thing is, nobody will give a good consultation charge for the house visit. So they will give 100 rupees or 200 rupees. You might think that it is helping our pocket money, and ultimately you are doing an unethical degradation of professional value. And the patients will never give more money to a qualified physiotherapist. If a teacher or the clinical instructor is telling you to go and see a patient means, go to the principal and tell, why are they telling me to go and see the patient? House visit and all. Do not go. One more thing you remember, how the medical profession evolved. Once they got the identity, they stopped house visits. We see now very few nurses or very few MBBS graduates go to house visits only for critically ill, end of life, okay, terminally ill patients. They can die anytime. Such kind of people only they go for house visit, and that too it is arranged by the hospital itself, and the hospital ambulance goes, nurse also goes, the doctor also goes. That is home based health care, that is done by hospital. Don't go at an individual level for an house visit during third year and final year, because you are vulnerable to be exploited, because you are a student, not only financially but also personally. So I am trying to bring it about one issue which came up in the last year about a web series which has actually projected a physiotherapist, a female physio, as a what is called as during the treatment and therapy she is seducing the elderly old man and getting into a sexual affair with him. Okay, so physiotherapist means massage, old those days. Spa centers, massage means other type of prostitution. Okay, and if physiotherapist is going for house visit, a girl physio is going, means they'll be again definitely getting chances more to be exploited. So please do not go for house visit. After that, don't tell that that patient is misbehaving, this patient is misbehaving. You have given the opportunity. You should be in the professional environment, not in the personal environment of the person. Will you go to a stranger's house? Will your parents allow that you go to a stranger's house for 100 rupees and 200 rupees? Remember that. Okay? For boys who are doing house visits, please understand one important thing of how you maintain what is called as the professional dignity. Okay? Many times the bargaining, negotiating the consultation fee in the house visit comes there. Okay? To the students, especially boys. Boys are given sometimes the coffee or the tea or refreshments. So these all things and all unnecessary. Please do not go there, and you are mostly victimized, like you have misbehaved with the patient. Okay? A boy student goes for house visit, or boy student is treating the patient in the OPD. Patient is a female patient who is a middle-aged lady, married or divorced, husband is in Middle East. Unnecessary problems. So make sure that you are always with the faculty in your clinical posting. When you are with the patient alone means let the area be open, and also make sure that you have one classmate of yours always together, two of you. Remember this for your safety. Okay? Because what happens is sometimes some patients start undressing themselves in front of the student. The student is put in a very awkward position. What to do? Okay? So these kind of things should not happen. So always preferably keep the same gender of the patient should be your company. So that means if it is a male patient and you are a female student, keep a boy with you together. And the same way, a boy who is treating a female patient, keep a girl together with you, your own batchmate. This is very, very important, because this gender interaction is taking a very bigger turn in every scenario. This is not just for students, even for therapists who are in clinical practice. I am going to explain more in clinical practice issues that is coming up later, the subsequent days, tomorrow maybe or day after. But make sure that students are aware of this and do not encourage exploitation at any level. Don't think that I am a student, whatever money I am getting, it is better. Many colleges in North India, I see that private institutions, students bunk the classes and they go for house visits. That is highly prohibited, and it is illegal that you treat patients' house visits before getting qualified. So don't ever think it's okay until somebody finds I will do it. No. Right? And also, when you are seeing for patients with orthopedic problem, neurological problem, cardiopulmonary problem, the third and the final year, make sure to maintain a single notebook. In that notebook, divide that notebook with folding the paper, orthopedic, neuro, cardiopulmonary, like that. So in a clinical posting, if you get an ortho case, note down at the ortho part of the notebook. If it is neuro case, write it in the neuro part of the notebook. Compile all the ortho cases together. And the same way, don't compile day wise. Okay? Today I have seen 10 cases, write all the 10 cases together. No. Compile the cases subject wise. Okay? So that way, when you are reading that subject, when you are reading the textbook of that subject, excuse me, or reading the class notes of the subject, parallelly see the clinical notes of that same subject. Importance is what Jeffrey Maitland told, permeable brick wall. When you are listening in the classroom, you are thinking about the patient, parallelly relating it. When you are learning from the patient or in the clinical area, you are integrating the classroom knowledge also parallelly. In this itself, basic level of knowledge to practice bridge is developed. So organize the cases as per the subjects. It may be neck pain will be there, back pain will be there, classroom only cervical spine is taken, lumbar spine not yet taken, no problem. When the lumbar spine is taken, get back to this clinical notes, see for who are all low back pain and what all happened. Just to see that. Try to learn from that. Get an idea. Explore yourself. Okay? And go to the best people. The catch is, best people are strict. Okay? Don't think that lenient people are actually good. Maybe they may be good. Lenient people are good. Careless people, they ignore all your mistakes. You do lipstick and come, you wear big nail and then nail paints and all that. Still everybody is ignoring. They may be a nice person, but the strict person will make you the best. Okay? So remember that, and always strict people are the best people. If somebody is not strict, they are compromising their values in the hospital and clinical postings. How you are expecting them to have values as a human being? Okay? So ensure that, and they will actually misbehave with you only later. So don't go after the lenient people, go after the strict people, because a strict and a strong sculptor, I told you this example in the teacher's issues, that sculptor makes the god out of the statue, the rock. Okay, the statue out of the rock. A strict person will hit more harder and ensure that the statue is worshipped by everybody as God. A lenient person will think that whatever the shape of the rock is okay and we can keep it as a showpiece. Irregular shape of the rock also is okay because it will be attractive as a showpiece. You want to be a showpiece or you want to be treated as God? Remember, within everybody we have that power to make other people better. We can make them by our words, we can make them by our expressions and emotions, we can make them by our hands. And as a physical therapist, we are bound to be blessed with these hands that can make a better world for the people. So we should ensure that that same passion gets translated, and of course the best effect comes when you are a best human being, then you can be a best professional. Okay? And when you are coming to, sometimes during the exams, it is difficult for the students to maintain that interest in the clinics. Okay? So clinical posting, they'll be with the books or the notebooks and they'll be looking that only, reading that only, because the exam is there, all this thing might happen. So make sure that practical exam you should also prepare. So whenever you come to clinics, think about the upcoming practical exam, PT neuro practical exam. What are the things that is asked in the internal examination? Okay, now university is coming. So internal examination, these are things the teacher asked and I didn't answer. So in practical, try to learn that, so that you will not mistake the mistake of the first examination in the second examination. See, doing mistakes is natural. Doing the same mistakes again and again is ignorance. Okay? You have to make new mistakes? No. Okay? You have to learn from your mistakes and make sure that you are getting into a phase where learning is important. Okay? And not feeling negative that I did a mistake, so what to do. Okay? Everybody does mistakes, everybody falls down, but they are coming up in life, they are getting up again. Those are the people who are most successful than people who have never done mistakes. Okay? Because failure is always the stepping stone to success. You might fail in the practical examination. It does not make you what is called as a horrible therapist. Okay? You can't be a good professional, nothing like that. Okay? Teachers will shout. They are shouting because you have to realize the importance and get better. No human being can judge another human being. because the teacher is telling that you can't be a physical therapist. What is this? Horrible. You don't know anatomy, you don't know anything, you don't know how to do this passive movement also. What you are going to do? They might shout. Understand one thing, that they are shouting because they want you to change and become better, not because they want to, they have decided, they have told the truth, and that only is going to happen. The extent of what is called as the tension for theory exam versus practical exam, students are more afraid for the practical exam only because clinical posting, they have not taken the responsibility, they have not taken the notes, they have not made the list of cases as per the subject. All this when you do, automatically your confidence level will be far higher than other irresponsible students, okay, who are always running away from the strict faculties. But when you go with the strict faculty, you are going to become a diamond, not a charcoal. Charcoals are there, they will be used only for burning. But remember, the diamonds, they are also made of the same carbon, but they have come up to that level, means they have faced mechanical forces, thermal forces, every type of what is called as deformation for the carbon. Then only carbon becomes diamond. Understood? So take it positively and ensure that everybody is telling inputs to make you better, and keep it as outer shell of yourself. Don't take it to heart. Start crying if you are a girl. Never. If you don't have emotional stability, you can't treat other patients. Patient is crying. Student, you also start crying. What is this? Students calling patients, uncle, come, idhar baith jao, sit down. Auntie, do the exercise. What is this uncle, auntie? In clinical posting, they are strangers. Call them sir, madam. Internationally, you see, students will call Mr., Miss, Mrs. That's all, with name to the patient. Mr. Senthil, can you do this? This is what they will ask. They will not tell uncle, Anna. Why you are building unnecessarily one relation there, personal relation there too. Okay? Your parents will feel happy that you are calling somebody else as Bhaiya, or your what is called as, how somebody became your uncle or auntie. Don't do this. Internship is one kind of a next phase, which is another kind of a beautiful phase. Okay, I'll tell you why. But remember, in studentship, make sure you maintain this and utilize it for learning, upgrading your skills. If you are attending extra workshops, you are learning anything, try to discuss with your faculty, okay, or with the clinical instructor, and then use it on patients. Because what you learn in a webinar or in a certification course, you cannot develop the skill unless you use it on the patients. If they don't allow, don't use it. No secrets. Use it only on your parents. Use it on your uncle and auntie, real uncle and auntie, not the fake uncle and auntie. Okay? So it's very, very important, and ensure that your learning versus your application, both should go hand in hand. And practical exam is also important, and ensure that in what is called as, I have told in the student issues itself and also in the syllabus, that in lab also you can act as a patient, another student is acting as a therapist. You have observed the clinical area. The same way, the communication between therapist and patient as a role play, and you can do in front of the 10 students in your own group. And every student in every college knows that there are always free hours. Okay? There are classes, but there are times when there are no classes. those times go to the practical lab. One is acting as a patient, another is acting as a therapist. Do the activity so that the clinical area can come into the classroom also, practical lab, and you are more confident in the clinical area also because you have practiced that in the lab. If a faculty is free, especially the strict faculty, request them, sir, can you come and explain those techniques, how to do. We will also share our observation, what we saw in the clinical area. If you are doing wrong means please tell. Okay, so always it is welcome that strict faculty will be very very happy to come and help you. Even out of the college hours also that faculty will come and teach you. That is why they are strict. Don't be distancing yourself from that strict clinical instructor who is telling about discipline, because they are telling that because patients have to respect you. If you maintain that dress code, maintain the discipline, means patient is going to respect you better. And you should be seen as future doctors. They should not see you as small kids. Another common mistake which during the clinical posting, including of first year to fourth year, final year, all the BPT students, in fact any undergraduate students does is healthcare especially, is clinical area chit-chatting about other things, entertainment, or taking the coffee and coming into the OPD. Okay, because coffee shop is in the same hospital, they will have coffee shops every floor. It is especially for patients and the patient caregivers to have that. Students having that, it's again in the OPD it's prohibited. And same way, use of lift also. In the hospital lift, it is given that it is only for patients. Please make sure that you are young and you are a physical therapist. You should go by the stairs to keep your heart healthy. If you also want to be a patient, you use the escalator, you use the lift. Why are you prescribing exercises for others if you cannot do? So make sure that you set an example. Be prompt to the clinical area before the attendance. Ensure that a strict clinician is always the best to learn. Ensure that your group discussions and also noting down as patient logbook, case wise, subject wise, you are organizing the cases, periodically taking case presentations, case discussions with both the clinical instructor and the classroom teacher. If it is not happening, don't blame that our college nothing is happening. Hey, go to the principal and tell that these things we want it to happen. It is your responsibility. Give an application, request. We need case discussions weekly. Ask. What you ask only you will get. You might get only 10% of what you ask. But if you don't ask, you will get nothing. Why later you have to attend workshops and learn? You can't utilize the college? Your parents' fee is not valuable? Clinically you have to learn. Otherwise, what is the use of the degree? If you have joined in a college without any facilities also, at least the teacher should teach about patients. How the patient has to be treated, what all questions has to be asked in the patient. These all demonstrations should come. Case-based examples should come. Case-based practical demonstration should come, not condition. That case can be a video in the internet also. YouTube, one gait is there. Person is walking, hemiplegic gait. That video, let the staff discuss with students. Case-based training. Even if hospital not there, OPD not there. Do not leave it. Students, it is your responsibility to learn. You have to be the flag bearer that I have to get the best for the money that I paid in the college. Internship, you should get a stipend. Be it government or it is private. There are many private institutions giving stipend to the interns. So you should get. And there are options to do internship in the same college or internship in the other colleges. In fact, hospitals. Attached hospital itself or hospital of your choice. Sometimes in that malpractices are more common because many students will try to join job only after final year. And that hospital provides like 6 months internship certificate. But actually the student is appointed. The intern is actually appointed as a therapist there, getting salary there, but getting the certificate and they are submitting in the college. So this kind of malpractice is happening. Why I am telling malpractice? 6 months is for internship, it is for learning. You can get stipend. It's not for appointment as a therapist. Don't be in a hurry. You can earn. But remember, L comes before that. You must learn. Okay? Then comes earning after learning. So ensure these things are taken care, and in internship ensure that you attend enough number of workshops from genuine resource persons and valid, recognized and registered academies and associations. Also take professional memberships or student memberships either in the national body, students wing, or the what is called as our Indian Association of Physiotherapists itself. Okay. Be part of the what is called as the clinical camps, because camps are best places to get large volumes of clinical exposure at one time. There also ensure that you take notes or you pick up case list according to the subject. Okay, documentation and interactive learning, discussion, everything should be followed even in the camp. Don't think that it is just a trip. You go there to that village, enjoy the local whatever refreshments they gave, come back in the college bus like, oh, papa, camp ho gaya. Camp is over. Learning. We are going, it is a community based environment. So that environment, how we gave, how much the people are respecting. Remember one thing, the city people, they treat you like shopkeepers in the clinic. If you are not a professional, they will see you as just as a businessman. Salesman treatment only you will get. But in villages, they will treat you as God. So you can do genuine service. You can really, what is called as, make a change in the lives of those people. So utilize these kind of moments to realize the value of being a doctor as a healthcare professional. Don't think that villagers, they don't understand anything. They are nasty looking. Okay? Or they are what is called as very tough to make them explain and all those things. Most important, learn the local language. In your clinical posting, without learning the local language, you are zero. If you are studying in a college in Karnataka and you want to clinically learn, means you need to learn Kannada. If you are working in Maharashtra and you want to clinically train yourself, means you have to learn Marathi or at least Hindi. Language learning can be limited to the clinical communication. Pain, where is it? Okay. Home advice, sitting, getting up, lift the arm, okay, turn this side, that side. So simple instructions, supine lying, prone lying, side lying, breathing. So these kind of things, instructions alone, you can learn. See, if you have the interest, means you are learning Android game. Yourself you are exploring and you are learning that game, na? 10 times you will make mistakes, but after that you are scoring in that game and you are scoring 10,000, 20,000 like that in the Android game. Why can't you do that with learning a language? Because learning language keeps your brain younger. Local language gets the communication barrier destroyed. And your practical exam, that patient, whatever language, however difficulty the patient is, still you will be able to manage better. No examiner wants to listen like the student telling that language problem, sir. Even if it is MPT students nowadays are telling this. Language problem, sir. What is this language problem? How can you tell that language as a problem? If you are a good therapist and sincere therapist, some students even teach their language to the patient. Instead of learning patient's language, students, they teach their language to the patient so that they can communicate. But remember, whatever way, the best professional exchange of information happens through communication. And language is a major method of communication for evaluation and treatment. If you cannot talk or they cannot talk, means very tough for physical therapy. Nowadays you see that it is even the blind people, they are learning physical therapy. Because it is not what you see, it is what you feel. It is not what you think, it is what you do that matters. So remember, but a dumb person cannot effectively do a physical therapy treatment. I'm not telling that verbally challenged means they cannot do physical therapy, but it's much more tough. Patient who is not talking or mentally challenged, or they are uncooperative to give you or talk with you, definitely the therapy is very tough. Also, how to handle the problem patients. Okay, in internship, for example, some patients may be totally uncooperative or they are misbehaving, means you know the solution, that directly report to the clinical instructor. And as an intern, you can't have a batchmate with you. 2 interns treating the patient together, highly prohibited. No clinical instructor wants an intern treating together with another intern. So if you want opposite gender patient, opposite gender, you want a company for your safety, what you do is take the student along. So if you are a girl intern and you have a male patient, keep a final year boy with you. Same goes for the male intern who's treating a female patient, keep the girl final year student or third year with you. Next thing goes to what is called as how you are teaching the students when you are as an intern. Because remember one thing, every learning is only through teaching. It is retention is 90% when you are teaching. As an intern, it is your duty to actually teach the students as an informal conversation or as a healthy exchange of information, inspecting their patient records, the case logbooks which they wrote, or the what is called as even narrating past experiences with different patients, what happened, okay, narrating it like a story also. Even interns can moderate the end of the day clinical discussions of the students, okay, so that there is a healthy interpersonal exchange of knowledge, okay, because peer group learning, it's always very, very important when it comes to clinical learning. I have also told about this, interns actually will be preparing for the postgraduate exams. They may be applying in competitive entrance exams, national level, but do not bring those textbooks in the clinical postings at any cost. Unless you have got the permission of the instructor, yes, afternoon, last 1 hour, or 2 to 3 immediately after lunch, not much patience. So that time you want to learn that from the books means please take permission from the instructor, inform them, then read your books. There is absolutely nothing wrong in somebody asking a permission. If the teacher tells, how dare you ask me this? That is their nature. They didn't agree, don't do. Okay? But a sincere teacher will never stop that. They will tell that, okay, no problem. But whenever patient comes, immediately you be there. I will not be calling you because you are intern. You make sure that your batchmate only will come and call you because you are seeing 3 patients. Because in internship, you are allotted patient-wise. This patient is your patient. Whatever time they are coming, you only should treat them. Because interns are there full day. Same intern will be treating every day that patient. But in studentship, one day one patient, another day another patient might happen. But you make sure that the same patient might come after 3 days. But you would have written previously, see that. Then observe today. Okay, so that you can get the connectivity. Sometimes notebooks can expire, it can get over. But now you have the solution. Scan the notebooks, keep it as soft copy. Why? Because these digital copies you can refer after you have graduated, after you are treating patients in your own clinic for 5 years. Refer to that notes and see, oh, these are things I have done during my BPT. This much only I know during that BPT. It's a self-reflective learning. Clinical case logbooks, very, very valuable. Because you refer that when you are practicing as a clinician also, you will get that passion that now also I have to make documentation, case files and records I should maintain properly. Because learning is a continuum. Degree will come, degree will go. You will pass it, you will get convocation, you will throw the hats, you will put pictures that, finally my graduation is over. What graduation is over? Learning never is over. Anybody is telling congratulations you passed the BPT degree means laugh at them. My patients have to improve. Every patient who is improving is my congratulations. That is what makes me deserve that degree. Otherwise the degree is just like ABCD, it is BPT. Just letters. Be it whether PhD or anything. It does not matter at all. You have to come to that kind of a value-based professional. Okay, don't be like outer part, attractive thing, respect is there, commercially I am successful, all this thing. Anybody can be commercially successful. Even cheating people are earning more money. Okay? Genuine service. Make sure that the other person becomes better. How you are improving your knowledge. Entering into the workshops and skill training part in the internship. Okay? Even MPT who are in clinical posting should follow the same. Never think that you are MPT. Make sure that you are mentoring the students, undergraduate or the interns under you. And make sure that you are discussing about the cases. Not just your project related cases. Project related cases, always your guide is important, your project guide, the thesis guide. But when it comes to other patients, the clinical instructor is important. So remember and always see that there is a lot of system by which you can improve your clinical skills. In AOMPT, our academy, we have case-based webinars. Continuing with the trend of improvising the courses every time. We don't repeat the same course again and again. Okay? If I have taken certification in neuromanual therapy CNMT last year, February, this center was established in February 14, 2021. But in 2022, the NMT specialist course comes with case-based webinars, case masterclasses, case discussions, case demonstrations. That is the 13th February we are taking certified NMT specialist. 2022, any of the courses of 2021 or 2020, if it is getting repeated, it will not be the repetition of the content. It is the improvisation of the content in patient perspective. Because clinical learning, clinical skill comes only in a patient-centered and patient-based learning, called as the problem-based learning. So remember, and of course, the presence of Ritu ma'am and Darshana ma'am always has been the driving force of all the master classes throughout. We have our members, core committee, Dr. Udaymala, Dr. Ajay. Other people are non-members. Dinesh or Rajanna, Puneet are all non-members. They are not yet joined the AOMPT. Okay, they have not taken the most important decision of their life. Okay, they are still stuck in ambiguity. It's important to maintain the line between the patient and the therapist as a respect through interaction. Okay, Ritu ma'am has mentioned that she is a very experienced clinician. She has handled different ages of patients, children, elderly, orthopedic or neurological, and madam has always been a front runner in taking case webinars of the AOMPT. Okay, maximum case webinars have been taken in the AOMPT by Ritu Sani ma'am. Okay, so she is also famous. Her webinars are always famous for the case examples. Dr. Darshana, yes, our General Secretary, perfectly explained, sir. Case-based training is absolutely necessary. Also, maintaining discipline in the OPD and wards is also essential. Professional relationship also has to be followed with resident doctors, nurses who are males and females is also necessary. Yeah, okay. Because sometimes other professions might take you for granted. They will try to talk extra. All these things will happen. Remember that. Make sure that the hospital environment or the clinical environment, the purpose is not getting compromised. Okay. Sometimes we even have issues of misbehavior of students among themselves, boy and girl, doing all sorts of prohibited behavior in the OPD or in the hospital itself. So these kind of things, please don't ever think about it. Okay. You have a lot of other places to do all those things. If you are a mature adult, make sure that have the confidence to inform your parents and then do whatever you want to do. Okay? Because you are a big boy, you are a big girl means face your parents first. If you cannot face your parents, you are still kid only. If you are a kid means don't do all those things. Understood? And having, for example, cigarette packets in the apron, lighter, matchbox, all these things in the apron or in that during the clinical postings, avoid totally. Make sure that if at all you are having these habits, try to limit that to only outside and without apron. Don't wear the apron and go and do the smoking. Don't wear the apron and go to the movie theater. Don't wear the apron and play between boy and girl physically on the road. Pushing each other, pulling each other, hair. Okay? So make sure that you are degrading yourself as a person. That is your choice. You might think it is freedom. You might think it is feminism. Girls can misbehave publicly on the road. That is feminism. No, it is fake feminism. Girls should think of achieving what the boys are achieving. The achievements you have to do, not the bad behavior. Boys, B for boys, B for bad. Girls means G for girls, G for good. Because they are bad, I will also be bad. That is not feminism. They are achieving, they are successful, they are working long time, they are establishing a long career, they are winning awards. I should do all that. That is feminism. Genuine, true feminism. So remember that and ensure that at every stage everybody needs a mentor. Okay? A strict mentor is always the best, be it among the teachers, be it among your relatives, or be it among your own seniors. But ensure to share everything with them, because most of the times students rush into a conclusion like committing suicides or substance abuse because they can't share it with anybody. Okay? Especially during this classroom, clinical, theory, practical, final year result, then intern, then internship, job tension, higher study tension. Okay? So a lot of confusion, career related decisions, all these things comes up during internship. So a lot of stress is there. You need to share properly and get the best guidance. Wisely choose the people, join the academies which will be responsible to make you the best, so that your whole career is built upon with that membership of that academy. Good luck to you all. Really happy to get inputs. Mahesh Tiwari, I think sir is also not a member of AOMPT, but thank you for the inputs that you are telling, good explanation. But remember that this video, feel free to share it openly so that everybody will get the inputs. Not only this, all the professional issues webinar series here, around 7 to 8 webinars I have taken in the AOMPT Facebook page. Please share it explicitly with all the students who are in your contacts, all the physios who are in your contacts, so that these issues are looked upon positively and we all develop a collective perspective on solutions, so that we have a better future that follows the next generation of physios. Okay, so I appreciate the presence of all of you here, and it's a pleasure as the chief instructor of the AOMPT, and also taking all these courses which are patient-centered approaches which we evolved and developed in AOMPT, and we have case-based learning throughout. Okay, so enjoy the evening, inspire each other, stay smiling, stay cheerful, stay as the best, no compromises. Good luck to you all. God bless you all.